In this video, we will demonstrate exercises and stretches to carry out following your knee replacement surgery. Once you have been reviewed by your surgeon at 6 weeks and are ready to progress, we recommend the following exercises. Please see a physiotherapist to assist you in progressing to the next stage of your rehabilitation. We suggest you complete the programme up to 4 times per week. We recommend completing each exercise 20 times, increasing to 30 repetitions as you feel able. If you cannot do all the exercises in one go, take short rests in between. Hold the stretches in this programme for between 15 to 30 seconds and repeat 3 to 4 times. Speak to your physiotherapist if you have any questions. Sitting on your bed or couch with your back supported for comfort, place a towel around the foot of the operated leg and hold the ends of the towel with both hands. Bend the operated knee, sliding your heel towards your bottom. Use the towel to help assist bending the knee further. That's really good. You should feel a stretch or discomfort. This is normal. I'm just straightening out that leg again. If you feel it is too painful, then do not force the movement as much. Sitting on a chair, place your operated leg on a chair in front of you. You may feel a gentle stretch on the back of the leg. Allow the leg to relax so it can gently straighten as much as possible. Stand facing a wall and place your hands on the wall. Place the operated leg behind and the non-operated leg in front. The operated knee should be straight and the non-operated knee bent. Lean forwards a little. You should feel a stretch at the back of the operated leg. So we're going to hold for 10 seconds and then we're going to relax. Start sitting down with your bottom towards the edge of a chair. Place the feet hip width apart and arms across your chest. Lean forwards and stand up without using your hands if possible. Slowly lower yourself back down to a seated position by bending the knees. And again, up you go. Try not to drop too heavily onto the chair. Control the descent. If this is too difficult, you can use the hands to help push you up. Stand holding a chair or the kitchen counter for support. Bend your operated knee, bringing your heel towards your bottom. Slowly return to the starting position. Can you feel that at the back of the knee?
Yes.
Great. Perfect. Stand on the operated leg and balance for 10 seconds. Try to increase this time as your balance improves. If you are unable to do this unsupported, hold onto something to begin with. Stand by your stairs or a step. Place the operated leg on the step, followed by your other leg. Step back down, leading with your non-operated leg first. This will feel challenging to begin with, but will improve with time. Try to do this without holding on if possible. However, if you feel unbalanced, hold your banister or wall for stability. If you would like to book an appointment with the physiotherapist here to support you with this programme, please contact us at outpatientphysio@matterprivate.ie.